takes about 4 treatments with calcium EDTA to get you to the right level. And then you end up with the urine results with a little broader face. Because DMSA works on some, but not all males.
Do you recommend it for 6 months as a therapeutic trial?
Yes. But again, I would do it properly, learning how to do it, what to watch for, do a loading dose initially, get a urine challenge, and treat them with the proper dose 3 times a day appropriately, 3 days on, 11 days off, 3 daes on, 11 days off. Do a urine challenge again, find out where they are. They have this much metal, now they have this much metal, now they have this much metal. Stop for 6 months. Stop for a year, and go back to it.
Okay, finally, for how long do you use the hyperparachute?
I've been using it since 2005.
No, for how long? For the patient?
For the child. Most of the kids need at least 40 treatments in the spectrum, 80 treatments, 100 treatments. Most parents will see response and buy a chain for their house. That's what it comes down to. And they'll go in and they do like the kid with the anger issues. He might need a little bit 6 months later as a fine tuning. But you want to find a way of getting the kid to reverse as best you can. So I find it's a great augmenting tool. It's not the most important one, but it's many tools that we need. Yes,
Thank you for the very impressive lecture. But I want to comment on the first question. Why the twins, one or the two SIBs, one of them is affected and the other is not affected?
Right.
No, I have another explanation.
Good.
And on genetic basis. Autism is a multifactorial disease, polygenic disease.
Right.
So the gene should be present in the child affected, and the other one has nothing. That's why he took the vaccine and everything environmental, and he didn't show the disease. That's why we call it, it's not a Mendelian disease. It is, sure, genetic part is present, but not a Mendelian. If it is a Mendelian, it should be when there is a twins, both should be affected. But we have even twins and one affected and one not affected. And the gene is upregulated or downregulated with the food or with the environment, to what happened, all the toxins you give today. That's my comment. The other thing is that you make it dark for me, because all are toxic. I don't expect to know that all these things are toxic. If like that, there should be ethnic variation of autism, but there is no ethnic variation. Ethnic variation means that the percentage of autism, or the prevalence, or the incidence, or what we call prevalence of autism in USA, like in Egypt, like all are like each other. It is increased, and there is no epidemic or something in one country. Here we have a lot of mistakes and a lot of toxic environment, and still we are like USA, like British, like.
But you have the epigenetic.
Yes, it is epigenetic, sure.
Absolutely. But,
yes.
But we have a problem in the entire world with a lot of this pollution. So it really doesn't have as much of an ethnicity as what we're being exposed to in the food chain and in the environment around us.
Yeah.
And yes, certain cultures will eat certain things more than others, and nobody likes when I give this lecture, because they can't breathe the air, they can't drink the water, and they can't eat the food. But you have to know what you can eat safely and how to reduce your risks. But in answer to your point is very valid. You know, we have this all throughout, but like you said, epigenetic factors that we have are twisting our body's ability to repair. So I wish we had a great answer for uncovering the real reason. But the genes load the gun, and the environment pulls the trigger, and how the body's susceptible for it is the situation.
Thank you very much. It was really a very interesting lecture. I just have a comment and question. I just want to add to my Professor Dr. Nahwar Demir that we have a balance between the gene and the epigenes. The epigenes are the gene inhibitor for to upload or download when you get an environmental factor. The environmental factor inhibits the inheritor gene. So the disease appear, and this may be related for autism. For autism with epilepsy, especially a gene have been discovered 2 months ago, and it is now there is exome sequencing for autistic with epilepsy. This is my comment. My question is mandatory to use detoxifying agent as DEMSA, because it is a chemical substance. We can use the hyperbaric, or we use the antioxidant and other more natural product to get rid of this without the use of chelation. What's your opinion about that?
The effectiveness of the various chelators that are out there naturally, alpha-lipoic acid, cilantro, silymarin, things to help the liver work better, help, and acetylcysteine helps. But unfortunately, when you do studies on these agents in comparison to DMSA or EDTA, you don't see the total beneficial effects be anywhere near it. And unfortunately, chelation has a bad rap because it's considered harmful and it's not done properly. But if it's done properly, it is not harmful. It is FDA regulated in the DMSA factor for approved for lead toxicity and lead overburden. There are a number of excellent studies showing the various chelators that are out there and the effectiveness of them. But if you want to get good results, you can do those ion foot baths. It's not going to do much. You can do zeolite. It's not going to do much. If you really have a child, as I mentioned, and I showed some pictures of some cases, that people had a large volume of metals in their system, you're not going to get results, usually, if you try the others. Trust me, my parents don't want to chelate if they can avoid it. But when you end up with the question that you have is, can we use these other agents, these sulfhydryl group answers, to pull some metals out? You can use it, but you're not going to be as effective. Another good thing is an Epsom salt bath. You're going to sulfate, and you're going to help that person get their sulfation mechanisms working. If you improve their methylation by getting that cycle working, you're going to help that as well, but you're not going to get the metals out.
Okay, my third question, how long we can use Speak Smooth or for how many? Usually we said 6 months. It's 6 months.
You can use it. You need fish oils to reduce inflammation. Speak Smooth is a fantastic variety. It's well tolerated. The kids love it. You know, I start with Speak at 2 capsules twice a day. I'll get them, the parents will come in and they'll say, wow, I'm starting to get some words, 1 or 2 words together. You know, not one milk. You know, and then it's like, mommy, 1 milk, please. And it gets to that point, and then they have a problem with concentrating. And then I'll say, let's put a little learn into it. So we'll add learn. We'll knock the Speak down to 1 twice a day. We'll do learn 2 twice a day, and the Speak 1 twice a day. And then we'll bring the learn down to 1 twice a day, Speak 1 twice a day, and work with that. And there's no order that says, oh, 6 months are up, you can stop this. There's nothing harmful with fish oils if it's made from good quality source. And pollock, which is the source for the Speak and the learn products, that is a very safe low mercury fish. So when you have a good fish source that you can add this agent to help brain activity work better, you feel comfortable in doing that. I take care of patients with cardiovascular disease. We can give 12,000 milligrams of fish oil per day. So there's not a problem with long-term accumulation of a Speak product or a learn product or fish oils in it.
Okay, it's good, but we must be cautious for being epileptic patient.
For the epileptic patient?
Yes, for epileptic patient, it sometimes may increase the epileptogenicity. So it's in my mind, in my own view, I have to do an EEG for my patients before they start. It's much, much better. Many of them who started without previous EEG have got actually. Thank you very much.
You're welcome. Thank you for your questions.
Excuse me, Professor David, I'm here. Yeah. I know how much you're tired, and I thank you for the rich lecture. I have small 2 questions. First, about the precipitation of pesticides and chemicals in the fats of newborn female child. They say that starting the precipitation of these chemicals starts since she is newborn. and goes on until she is married, and then she secretes it in the milk for her kid. So what is the idea when you chelate? This means that you remove these chemicals from the cells, from the blood, or also from the fats, to guarantee that she is nil or zero polluted. This is number one. Another question about, you mentioned so many modalities of treatment. Yeah, so I'm asking about what's your opinion on neurofeedback. Neurofeedback is nowadays, they are speaking so many times about it, and so what's your opinion on this?
I wish I had more experience with neurofeedback in order to give you a good answer on that, so I'm going to have to take the fifth on that one and say I don't know enough to comment on that. The first question you had dealt with the timing of safety of a female to have a baby, to want to get the metals out of the kid, the mom, and plastics too. So sweat and sauna is really good to get rid of plastics. You want to get an infrared sauna involved. That's very safe and effective. That's another way of getting metals and toxins out. They measure it through the sweat, and they find that you can get some metals as well as some of the polyphenols and brominated pesticides out through sweat. So if you were to do that, it would be a far infrared sauna to do that with. But you don't want to chelate and mobilize metals in a person who's planning on getting pregnant within 6 months at least. Like you don't want to tell the lady to get dental filling and put it into her mouth, because you don't want to mobilize mercury at all. As the lady in the back was asking about, how do we determine when is the time to chelate or not, and where does the chelation work? Well, you're going to pull the metals out of the system, and then you're going to have what's able to be reached quickly. I spoke with you last evening, and I'm going to make the same statement. At 9/11, which was the worst disaster in United States history, if we were there, and during that day, in trying to help take care of the people and recover, we would be in the area to try to salvage. And we were being exposed to all sorts of chemicals that happened when the buildings went down. So if you did blood tests on those people that day, the next day, you would find mercury, you would find lead, you would find cadmium, you would find all these metals in the system, all these toxins in the system, in the bloodstream. But a week later, it wouldn't be in the bloodstream anymore. It would be in the fat cells. It would be in the brain, in the tissues, in the kidneys, in the adrenals. So it doesn't stay in the blood system long. People do blood tests on people and say, hey, you don't have any toxicity of lead or mercury or cadmium. There's no reason to chelate you. It's not in the blood. It's in the fat cells. It's in the tissues. So when you chelate somebody, you're not looking for blood level changes. You're looking for changes on the urine flow, the urine outcome, based on doing a chelator to pull it out. If you're not chelating, nothing's coming out. If you chelate, you're going to see something coming out. So when the graph goes down in size, that you don't have a lot of metals in the system, that's when you can say 6 months from now you should get pregnant.
Another question here.
Yes, sir.
Thank you very much about your last lecture. I'm asking about the hyperparagogy therapy in autism. There is one question in two parts. The first part is if you have a child with autism and clinically manifested epilepsy. With the first part, epileptic child with autism. The other part, if the child has autism without clinically manifested epilepsy, but he has EEG changes, abnormal epileptic charge in the EEG changes. Do you have experience about the application of hyperparagogy in these children or not?
Personally, I do not treat. I would have kids who have epileptic activity on EEG, but I wouldn't put them in a hard chamber with higher pressure. Because the higher the pressure you have, you lower the seizure threshold. So you have to be concerned a little bit about stimulating seizure activity with high pressure, 100% oxygen hyperbaric therapy. But in the mild pressure hyperbaric oxygen therapy, you're not running into that risk anywhere of the degree because you're only doing 1.3 atmospheres. So I like doing the safer form. Hyperbaric is safe in general if it's done with the right hands of people who are trained appropriately. But if you keep it low, your risk of seizure activity are not there. There was a case that was done in Russia where there was a child who was started in a hard chamber at 1.5 atmospheres and did fantastic with epileptiform activity prior and did not have any epilepsy prior. There was no EEG on this child beforehand. that was done. So you can't see if he had epileptic activity or not. And they ended up at 1.5, they bumped him up to 1.75, so a little better response. They pushed things a little bit more in Russia. And they brought him to 2.0 and then 2.4, and he started seizing at 2.4. So he was getting hyperbaric oxygen the whole time and improving, but they decided to push him up to 2.4. So that's causing problems with increased epileptic form activity at high pressure, 100% oxygen.
So you would recommend that every child who has autism has to do EEG before the...
It would be very good if we could do that, but not everybody does it. I think EEGs will help a lot. But if you did have a child who has a history of epilepsy, which I have treated kids with epilepsy in hyperbaric without having a negative response, because I do the safer version, in my opinion safer, because I'm not pushing the envelope with 100% oxygen and I'm not going high in pressure.
أي أسئلة أخرى يا جماعة؟ طيب احنا بنذكر بس ضروري جدا ان نكون كلنا ملينا الانفورميشن شيت عشان ان شاء الله الشهادات بتطبع في امريكا ونوصلها لحضراتكم لحد العياده، وعشان كمان في مؤتمر في فلوريدا للاوتيزم كان دكتور ديفيد نوه عنده اكثر من مره في المحاضره اللي هو مؤتمر الام بي اي او سوري الام اي بي. ان شاء الله هنطلع دلوقتي الكوفي بريك سريع لمده من 10 ل 15 دقيقه، وبعد كده هنرجع نكمل بقيه برنامج السيمينار بتاعنا. هيبقى في عندنا كمان بعد انتهاء الفقرات في الغداء ان شاء الله اوبن بوفيه. اوكي نتفضل دلوقتي على الكوفي بريك و10 دقائق او ربع ساعه ونرجع تاني نكمل بقيه السيمينار. اتفضل.
I will speak about the role of long-chain fatty acids in autism spectrum disorders, and forgive me that I have a common cold in my vocal cords. I will ask for treatment. I will tell you a short note about the fatty acids. There are